Hello, everyone. Welcome to another episode of the Anti-Pharmacist podcast. It is another Friday, and I welcome you to the weekend. I really can't explain or express how grateful I am for the birthday wishes, on Tuesday and over the week. Thank you so much. I received a lot of birthday wishes on social media, LinkedIn, Facebook, Instagram, and all of that. I really appreciate it. I am very, very happy. God bless you. Thank you so much for celebrating me. You shall all be celebrated in Jesus' name. Well, I told you on Monday that I'll be doing a TGIF episode about common side effects of medications, since the Monday episode was about reporting adverse drug reactions, right? Yes, so that's what I'm doing today basically. And I'm glad that I have talked about adverse drug reaction on Monday and the distinction between adverse drug reaction and side effects. I made you know that there's just a thin line between them because both of them are actually unwanted, but one is actually expected while the other is unexpected. Side effects are kind of expected because they have been noticed in clinical trials, all right? While adverse drug events or adverse drug reactions have not been noted in clinical trials, at least in a large population. So, when they occur, they are expected to be reported. Okay, without further ado, let me just get right into it. So, in the introductory part of this episode, I've basically defined side effects for you, but let me just explain it further, okay? It's just an unwanted effect of a medication. That is side effect, okay? That is the basic definition of side effects. They are unwanted, although they are kind of expected because they have been noticed when they use them in people with that particular disease you're treating during clinical trials. But the thing with side effects is that it is a probability, okay? There's a risk of having that side effect. So when you buy your medication and you open the package, you see a leaflet. When you go through that leaflet, it talks about the composition of that drug you're taking, the indications, that is what it is used for. The side effects are the next thing you will see. It will list them, what you should expect if you take this medication, all right? But the thing is, it is a probability. It is not set in stone that it will definitely happen. It is not a definite event or definite thing that will happen. I have mentioned several times on this podcast that what we consider in medications is risk and benefit, okay? Risk and benefit. Or will this thing benefit this person more than it may or can harm them? And if the answer is yes, we go ahead to deploy it. Or will this thing cause more harm than good? Oh yes, then we will not give it. We will look for alternatives. So that is how giving out medicine works, okay? So as for side effects, when you read all of them, maybe 20 or so, maybe on your Google or on the package leaflet, do not expect that everything will happen. There are people that take medications and they do not experience side effects at all. And there are people that take it and experience many of them, one or two. So it varies with people, okay? And side effects can range from mild to moderate to severe based on different factors. I've told you that we are different people. We have different DNA components. We have different reactions to medications. So you cannot expect that side effect that somebody felt is what you will feel until you have taken that medication. Do you understand? Yes. And like I said on Monday, if you experience side effects as well, don't keep it to yourself. Let your healthcare provider know. They might have a solution for you, to abate that side effect. Or if it's something they are envisaging, they are thinking that will become serious, then they can change that medication for you to another one. Yes. So I've talked about the severity level of side effects from mild to moderate to severe. Now, what kind of medications have side effects? I can tell you that virtually all medications have side effects, okay? May not be in all individuals, but they definitely have. From your over the counter medications to your prescription medications, even to your supplements and some medical devices too. Surgeries also have side effects. So, all treatment options actually have side effects. They say that there is nothing that has an advantage that doesn't have a disadvantage. The same thing applies to medicine, okay? Like I always say, risk benefit ratio is that criteria that we look at to determine if a drug, a supplement, a medical device, a surgical procedure should be deployed for treatment or not. Now, there are many medications in the world. I can't begin to mention each and every one of them and giving you side effects. I've given you the code. Once you get your medicine, take the package, check the leaflet, you see the list of possible side effects, okay? Or if you're not getting the packet, maybe you are getting a sachet, a strip, like that, just ask your healthcare provider that is handing this medication to you, what are the side effects I should expect? That means they will even know that, oh, this person is knowledgeable about their drug therapy. They want to know what they're taking in, which is very good. They will let you know what you should expect. For most oral medications, either your tablets, your capsules, your syrups, or suspension, they come with gastrointestinal side effects because this thing will pass through your mouth to your throat, through your esophagus, down to your stomach. All of this, once the drug has contact with them, there's possibility of side effects. Some drugs cause dry mouth. Do you understand? Based on the receptors that they bind to. Do you understand? Some drugs can cause stuffiness in the nose. Some drugs can even cause you to cough, dry coughs, the likes of lisinopril and antihypertensive. Some drugs can cause allergic reaction like sneezing, like itching, the likes of penicillins. Some drugs can cause nausea. You are feeling like vomiting. Some actually lead to vomiting. Some cause diarrhea because they cause some imbalance in your gastrointestinal flora. Some cause bitter taste in the mouth, like your metronidazole, your flagyl, or even a change of taste for a while. Some even cause black stools. Example is your ferrous sulfate. It causes black stool. So when you take it and you start seeing your stool become black, don't be alarmed. So these are common side effects of oral medications that you should expect. Let me just give a few examples of some common medications and their side effects. Okay, the angiotensin converting enzyme inhibitors, which are used to treat high blood pressure and heart failure. The likes of your lisinopril, captopril, ramipril, enalapril. Their common side effects, like I said, is dry cough. Then they cause something we call angioedema, which is swelling of the lymph nodes, the mouth, the tongue, the throat. It can lead to difficulty in breathing if not quickly treated. Okay, then your anti-cholesterol medications, your statins, atorvastatin, simvastatin, rosuvastatin, they are used to reduce cholesterol level in the body, right? They can cause muscle breakdown, okay? And they can also result in liver damage, kidney failure if care is not taken. It's not all medications that you take that you will see physical side effects immediately. Do you understand? It's not all medications that you take that when you take them, you start feeling symptoms of side effect. There are some medications that they start damaging organs if you're not careful. That is why while taking these medications, it is advisable that you do some periodic checks, your liver function test, your kidney function test, your urinalysis, your blood work. Do all of that while on these medications, and some of these medications are for chronic use, so take cognizance of this when you're taking medication. Don't expect that until you start feeling headache, or until you start feeling drowsy, or until you start coughing or feeling allergies. That is when you're experiencing the side effects. I told you that it's a risk benefit thing, right? It may not happen, but just to be sure, you have to do those tests. Do you understand? Then your antidiabetic medications like metformin can lead to lactic acidosis, although the risk is greatly reduced. That is why metformin is the only biguanide on the market. Other biguanides have been removed from the market because of that lactic acidosis that have been reported over time through post-marketing surveillance. So it has been removed. Only metformin is available, but there's still a risk of that lactic acidosis and reduced blood temperature. It can cause hypothermia if care is not taken. Okay. Then for antibiotics, the fluoroquinolones, they are used to treat urinary tract infection, bronchitis, and other forms of bacterial infection. But now, because of their irreversible tendon injuries, They can also cause peripheral neuropathy, that is numbness, tingling, even ruptures in the blood vessels, the aorta. They are almost the last resort when it comes to antibiotics, okay? Then your painkiller, like your aspirin, if care is not taken, they can cause ulcers, they can cause kidney and liver damage, okay? Some even cause high blood pressure, which increases the risk of heart attack and stroke. I'm not scaring you that you should not take this thing, no. I'm just telling you the common side effects, okay? So that when you are taking this medication, you take them exactly as prescribed. Trust your healthcare provider to give you only what you need, and once they have given you, follow their instruction. That is what I am saying, okay? Then talking about chemotherapeutic agents, that is anti-cancer agents. Most of them are cytotoxic. They destroy both the normal and abnormal cells because these abnormal cells actually mimic normal cells. So it is difficult for the drug to distinguish between them. That is why for those that take anti-cancer medications, they experience things like hair loss, erectile dysfunction, or even impotence, nausea and vomiting, diarrhea, constipation. They have reduced immunity, there's tiredness, they experience anemia, weight loss, mood changes. Some have mouth sores. All of this happen because of the nature of the anti-cancer and how they work. This is why they often need other medications to counter the side effects. Like I said, it's not that they will definitely happen, but they may. And if they do, please endeavor to report it back to your healthcare provider so that they can take the appropriate steps if necessary. Or they can at least allay your fear and say, oh, this is the common side effect. It will pass with time, with a number of days. And if it's something they have to give you medication to counter the side effect, they will do that. Okay. Now, for topical medications, the ones you apply maybe to your eye, to your ears, to your skin, the most common thing they cause is skin rash. The ones you apply to your skin, they can cause rashes, they can cause dryness of the skin, they can cause dry eyes, that is the eye drops. The ones you put in your ears, they can cause itchy ears or some kind of loss of balance for a while, that you not be hearing things well, things will echo. So also vaccines, they're a type of preventive treatment, right? They have their own side effects too. The fever, tiredness, body aches, skin reaction, like pain at the site of injection. Some people may have allergic reactions too to vaccines. So those are side effects for vaccines. For medical devices, I meant the likes of implants for people that use contraceptives. You might experience some side effects too, like headache. Do you understand? These are just common examples of side effects to expect. But in all cases, your healthcare provider will let you know of this, okay? And if not, your package leaflet will definitely contain them, okay? Those are the common side effects of these dosage forms. Did you know that side effects can also be triggered? There are people that may not experience side effect if they observe some things. Things like taking the medication according to dosage, not exceeding the dosage, not taking less than was prescribed or recommended. Because if you exceed it, your probability of having the side effect increases. That is one. Taking your medication with alcohol, drug interactions can result. Not following instruction, taking your medications with food that you've been told not to take it with drinks that you've been told not to take it with, taking your medication without food when you were supposed to have food in your stomach. Example of drug like doxycycline, a capsule for infections, is an antibiotic, okay? You should take it with food in your stomach because it is like almost like an injection, even when you take the oral capsule. Its bioavailability, that is the amount of medication ready to be circulated in the body system, is about 90%. It's like you are taking an injection directly, it's going to your bloodstream. It causes drowsiness, serious one if you do not eat. Now imagine the pharmacist or the doctor tells you, please eat before taking this medication, and you decided, no, I don't feel like eating, let me take it. You definitely experience that drowsiness. But if you eat, you may not experience it. Side effects can be triggered by negligence on the part of the patient to take medications according to instruction. Another thing that can help reduce the risk of experiencing side effects is if you let your healthcare provider know about any allergies you have or any peculiar health condition. Okay, if for example you have G6PD deficiency, that is glucose 6 phosphatase dehydrogenase deficiency, which makes it difficult to break down some medications in the body, leading to toxicity or increased side effects. You should let your healthcare provider know so that they can know to avoid those medications for you. Instead of you taking them, then you definitely experience those side effects and even more. Also, if you have allergies, you react to psyllium, you react to St. John's wort. A lot of supplements, they contain herbs, and some people have taken these herbs before and reacted to them. But because they are packaged now, you think they are different. Just let your healthcare provider know that I've taken this app before and I felt like this. Me, I'm allergic to granite too. Me, I'm allergic to this and that too. So that when they are giving you your medications or supplements, they know what to avoid, and therefore you reduce your risk of experiencing those side effects significantly. Another thing that can trigger side effects is improper storage of medications. If you do not store your medication well, some reaction might have happened to it that will trigger some side effects. Some excipients might have disintegrated. Do you understand? Triggering reactions that should not have been triggered in the first place. So please make sure that you store your medications properly. Then your risk of side effects will be significantly reduced. Now, not all side effects are bad though. We said that side effects are the unwanted effect of a medication. You took it not for that reason, you took it to address something. But let us remember and bear in mind that as we are using this medication, it is also doing some other things in the body. I mean, there are receptors in the body, and these drugs bind to these receptors. There are sometimes that the drug has affinity for some receptors that has nothing to do with your condition. These are the things that trigger the side effects. But not all side effects are negative. There are some side effects that can actually be positive at the end of the day. For example, finasteride, which is used to treat enlarged prostate, has been found to actually regrow hair. So men that are bald, for example, and are using finasteride, they may start noticing that their hair is growing better, just like minoxidil was originally marketed for high blood pressure, but it was found to grow hair. So some side effects will actually have positive actions on your body. Antihistamines that cause drowsiness have been used to induce sleep in people that have insomnia, just as some that cause craving for food have been used as appetite stimulant. You understand? But like I always say, any effect that you see that is different from what you expect, let your healthcare provider know. Did you know that you can experience side effects with a medication that you took in the past without a side effect? For example, you took a medication before and you did not experience a side effect, but now you are taking it maybe years later and you're experiencing side effects. It is very possible because our body changes with time. Age is a factor in anything, especially medication. Maybe some hormones have changed in your body, you have more fat deposit than before or less fat deposit that could absorb that medication. It could trigger a side effect. That's one thing. Another thing is maybe you have changed your diet, you've changed your lifestyle. That could be a reason why you're experiencing this side effect. Then it could be possible that some mutations have happened in your gene over the years, which is why you're experiencing this side effect. Another thing is it may be that you are taking a different brand of the medication from what your body was used to and you're experiencing a side effect. So side effects are not a one-off thing. Oh, I've taken this drug before, it did me nothing. Now you're taking it this time and you are experiencing something. Don't conclude that, oh, it's a fake medication already. You understand? It is very possible. Then I talked about mild, moderate, severe. What I've been talking about since morning, some are mild. The gastrointestinal disturbances can be mild and they can be severe too. It depends on the individual. You might have diarrhea, and for somebody else, it can turn to chronic diarrhea that needs to be treated immediately, that can lead to emergency. There can be allergic reaction in a person, rash, and to somebody else, it may result to hypersensitivity reaction or even Stevenson Johnson syndrome. You see, so there's a range of this side effect. It's not like is this particular side effect that is mild, is this particular one that is severe. It can actually move within that spectrum. One side effect, do you understand? Somebody can experience headache now from taking this medication, and in another person it might be severe headache going to migraine on taking the same medication. I hope you understand me. So it's not like, oh, headache is the mild side effect of medications, while Stevenson Johnson is the severe side effect. No. Other severe side effects are, for example, bleeding, gastrointestinal bleeding. It can occur from you taking your aspirin, as well as occur from you taking your warfarin if you're not careful. If you do not eat before taking them, if you have ulcer and you take this medication. I've talked a lot about drug interactions. Those are one of the triggers of side effects. Drug food, drug diseases, interaction. Do you understand? Please take note of this. That is why you should get your medications from your healthcare provider. Ask all your questions. Anything you are not clear about when it comes to your medication, ask them. They will answer you. That is their job, okay? Lastly, there's a paradoxical thing about side effects. There are some medications that, even though you are treating something, the side effect also has components of that thing. Those conditions need adequate monitoring. Drugs for anxiety, depression, psychosis, epilepsy, for Parkinson's disease, for Alzheimer's. Sometimes their side effects also include the symptoms of that disease, okay? And it may take a while for your body to actually adjust such that you will not feel those side effects again. I hope you understand me. We can't exhaust all diseases and their treatment side effects, okay? So please, while taking these medications, be in constant touch with your healthcare provider. Take these medications exactly as prescribed and recommended. I think that is all I want to talk about today about side effects. If you have any other questions about them, if something is not clear, please just put it in the comment section. I'll be sure to attend to them. Thank you so much once again for the birthday wishes. Thank you for listening up to this point as always. I'm loving your comments and feedbacks. Please keep them coming. And please, I don't want praises alone. No. If there's something you're expecting or you're not clear, please ask. I need those questions as well. Feedback should not always be positive. That does not mean you should abuse me. Please, I'm just doing what I know how to do the best way I know how to do. Okay. Please continue to engage the podcast on social media. Comment, like, follow on Instagram, on X, on LinkedIn, on Facebook. And please click the link that I post and listen to the podcast to the end. Make your comments, okay? Makes me know that, okay, this thing I'm doing is actually making impact. Thank you very much. Don't just like those posts and not click the links. That is the end point. Please clicking the links, and after listening, commenting, giving me feedback, then sharing. It helps the podcast a whole lot. Thank you so much. Thank you again. And you can still contact me on my email for collaborations, antipharmacistpodcast@gmail.com. I don't think I gave my social handles. Antipharmacist Podcast on Instagram, Fan Podcaster on X, and Bemisola Dipsy Jose on LinkedIn, Bemisola Dipsy Jose on Facebook. Yes, this podcast is available on Spotify. It's available on Apple Podcast, on Castbox, on Amazon Music. It is available on YouTube Music. Please check them out. And if you don't have any of those podcast hosting channels, go on the web. Just type Antipharmacist Podcast on your Google. It will bring out their episodes. You can listen on the web on any of these podcast hosting channels and even more. Okay. And when you click the link tree link, it will take you to the Spotify and the Apple Podcast. Okay. Those are the two places that are available there now. I'm working on adding others. Thank you so much for your support. And I know that you continue supporting me, okay? And I'll be bringing to you relevant information, not just about your medications, about your health, okay? About your well-being, about anything that has to do with your health in general. And of course, some juicy information about pharmacy practice in Nigeria. Please watch out for those. Enjoy the rest of your weekend. Till next time, stay healthy and God bless you.